Please have a look at a short introduction to platelet-rich plasma therapies with indications for use in a variety of surgeries and in facial skin rejuvenation. The basis for PRP therapies is whole blood, and in whole blood you find a lot of cellular mass, including leukocytes, erythrocytes and platelets. All the blood components have a variety of functions like the leukocytes and red blood cells. Platelets are known for their blood clotting activities and they are less known for their wound healing capacities. In the last decade, a variety of publications have been published with regard to PRP or platelet gel indications for a variety of surgical procedures. In recent years, platelet-rich plasma and platelet gel technologies have shown great promise and positive results have been obtained in, for example, orthopedics, plastic surgery, cardiac surgery and recently also sports medicine. Recently, PRP facial injections can be added to the list of application areas where the rationale is anti-aging or skin rejuvenation. This slide represents a single platelet in which growth factors are stored. Following activation, these platelet growth factors are released and expelled to the surrounding tissues, where they meet their specific receptors on the cell membrane. There are a variety of devices on the market which can be used to prepare PRP. On this slide you see the Angel device from Cytomedics, which is a computer sensor-controlled automated centrifuge in order to sequester a unit of whole blood into platelet-poor plasma, red blood cells and platelet-rich plasma. The rationale for PRP therapies is the release of a variety of cytokines and at least 6 important platelet growth factors, which all have specific functions with regard to healing of tissues. Once growth factors have been released from the PRP, they will find a dedicated growth factor receptor. At this stage, intracellular activities will occur with ultimately the building of cellular structures. In this slide you clearly see the difference of a whole blood sample and PRP sample. Within the PRP sample a very high number of platelets and leukocytes when compared to the whole blood sample, indicating the efficacy of PRP collection with these centrifuges. In Angel's PRP you will have an increased white blood cell count, consisting of neutrophils, monocytes and lymphocytes, and they all have their specific function. Apart from their phagocytotic and immune response activities, these white blood cells are also known for their source of vascular endothelial growth factor, which contributes to angiogenesis. Furthermore, there is evidence that PRP with leukocytes, apart from healing properties, have an antimicrobial response against certain bacteria. In an in vitro study from Moyen, with a very high load of bacteria, it was concluded that PRP kills Staphylococcus aureus in less than 4 hours, demonstrating clearly the antimicrobial effects of PRP. Growth factor therapies have had the interest of surgeons in an attempt to modify and enhance the wound healing process. Under normal circumstances, platelets play key roles at almost all stages of the wound healing cascade. PRP will therefore boost the healing process. In the wound healing cascade of events, a variety of cells are active. Platelets are the first cells to be active in this cascade, where they initially build a platelet plaque and release their granular contents, including growth factors, therefore triggering the next series of events leading to healing. As mentioned earlier, PRP has recently been used as a patient's own autologous injectate for minimal invasive facial skin rejuvenation therapies to treat, for example, skin wrinkles and nasolabial folds. The technique is very similar to the injection of hyaluronic acid or Restylane or other skin fillers. Generally speaking, the indications for PRP skin rejuvenation are facial voluminization, treatment of acne scars, a variety of wrinkles, nasolabial folds, or in combination with rhinoplasties. Recently, surgeons also use PRP in combination with fat for lipofilling purposes to increase the longevity of these grafts. With facial PRP injections, there is no need for the addition of thrombin in order to release the platelet growth factors. Tissue factor and collagen present in the dermal structures will initiate a slow platelet activation with a subsequent release of growth factors. Rodelli and Associates were one of the first to publish their results in a series of patients on face and neck revitalization using PRP injections. They performed the PRP injections in a similar way as they did with other filler injections. One of their conclusions was that face and neck revitalization with PRP is a promising, easy-to-use technique to improve skin texture, skin lines, skin elasticity, and the reduction in wrinkles, with high patient satisfaction of therapy. It is evident that collagen synthesis and type 1 collagen formation is crucial in skin rejuvenation therapies. From the literature, it is clear that there is a dose-related relationship between the absolute number of platelets in the PRP and a significant effect on collagen formation. The PRP facial injectate should have at least a 3 to 4-fold increase of platelets compared to baseline whole blood values. PRP facial injections are safe to use and are an effective therapy in the treatment for skin rejuvenation, anti-aging, as demonstrated by a recent paper of Sclafani. To conclude, the advantages of autologous prepared PRP for facial injections include less encapsulation, granuloma formation, and chronic or delayed infections when compared to the temporarily resorbable fillers with less foreign body reactions.